The amount of times I've had patients come to me who are like, well, I've got no pain, but I just know it's a mess in there, and I know it's awful.
44% of the general public have a fear of going to the dentist. I can't understand why. But, it is what it is. Mm-hmm. We both experience that all the time. It'd be great to have a little discussion about how you approach that in terms of dealing with dental anxiety with your patients.
Absolutely. I would start off by encouraging patients to do their research and try and find a practice or potentially even a dentist that aligns with them. Be open when you call up the practice. Tell the receptionist that you are nervous, because we can do various things to kind of accommodate that, whether it's extending an appointment time or even just having a visit that isn't an exam, but just to be able to pop in and meet the dentist. I would say don't be afraid if you haven't clicked with your dentist to go elsewhere. Don't feel pressured, because the reality is if you're not clicking with the dentist, you're not going to maintain good oral health, and we're not going to build on kind of that good first interaction if it hasn't been a good one. So don't be afraid to shop around to find someone that you do really get along with and feel comfortable with. And also the most important thing is don't feel like you're being judged. I think the hardest bit is to take that initial step and make that first appointment, because you're worried about what potentially is going on in your mouth. The amount of times I've had patients come to me who are like, well, I've got no pain, but I just know it's a mess in there, and I know it's awful. And actually you go in there and there's nothing wrong, or maybe there's one small filling that needs doing, but it's that build up in their head that everything is going to be horrendous in there. And even if it is a bit of a sight in there, that's fine. We're not judging you. That our whole job is to help you and get your teeth into a place that you're able to eat and smile confidently.
Yeah, and it's interesting. Dental anxiety, in the past, it's something people didn't really talk about because it's something that was acceptable. But I think people are more open to talking about it now, and I think that's a good thing. We actually have dentists that specialise, that treat specifically anxious patients. And I think that's great recognition of that. I think for me, something that you just said was really resonated in terms of ensuring that you tell the reception team that you are a really nervous patient. For me, that's really helpful. If I see that at the beginning, first of all, I'll give longer for the appointment. And I probably will change my approach slightly. I'll try and be a lot more, just to give them time to listen. If you give someone time to talk and they really feel as though you're listening to their problems and you really want to support them, it just makes them feel more comfortable. I know that in some of our practices, dentists that specialise in anxious patients, they won't do anything for the first appointment at all. It literally is just a conversation, just to see how you feel and just to be a good listener.
Absolutely. And I think obviously the aim would be to get patients into a position that they feel comfortable having treatments. But I think the final point is just if you are anxious, that's absolutely fine, and it's nothing to be embarrassed about. And as a top tip, just reiterating it, is just communicate, let us know, and then we can absolutely adapt, because it's in our interest to get you to kind of optimal dental health, and we'll do whatever it takes to get there.
And the thing is regardless of what you think of your oral health and how bad your teeth are, I can guarantee that we've seen a lot worse.